Recording now. Don't say anything bad about me, okay? Okay.
Thank you.
Okay. So I'm going to go to the groups tab on your department here. I'm going to go to the department level. I'm going to hit plus here to add a new group. We're going to call this group Z-archive. And the only reason for the Z is because it'll sort it to the bottom here. And we'll call this archive plans. And then I'm going to go ahead and save that. Now, typically on an archive plans, you want people to be able to view them and not necessarily edit them. And by the way, you can change that individually by person. So I'm going to say all view. So everybody will have view access to this new group called Z Archive. Now to get it down to the bottom, I'm going to go down here and change the parent group. Right now, the parent group is the department. In order to take it out of the flow of things, I'm going to change the parent group to itself. So Z Archive is reporting to itself. When I save it, it should move down to the bottom down here. Hang on a second. That is, okay, so there's a group missing. Who should EPI be reporting to in your department here? What group?
You can put EPI under CD,
C.
communicable disease control.
Okay, under communicable. Okay, so I'm going to go down here and select communicable disease and then save that. And what happened, it looked like there was a group that got taken out. And then we have Z Archive and training down here. Oh, I forgot to change the group level of Z Archive, my fault. And then save it. There we go. So now it's down at the bottom. Okay, so now, are both of these plans outdated at this point in time?
Yeah.
So they should both be archived? Okay,
Yes, please.
so it's all I need to do to archive them because Z Archive is a level 1 group and CHIP 2021 are level 1 groups. I just go down here and change the parent group to Z Archive and then save that, and boom, it moves down to here. And then I'm going to go back up to CHIP 2021, do the same thing. And by the way, only people who are org admin level users can do this. So I think all of you guys probably are. So again, I'm going to call it Z Archive as the parent, save that, and there we go. So those guys are out of the way now. CHIP 2024, is that current or is that something you want to archive as well?
Yeah, that's the most current version that we're working with.
So we'll leave that up there where it is. Anything else down here that you see that you'd like to archive?
I don't know if maybe Graciela, you have an approach, and feel free to let me know. We are confirming, or not confirming, but we want to reconfirm that the goals for each of these sections, so you see clinic, CMS, CW, emergency preparedness, this communicable disease control, like we want to confirm, because they had a list of section goals that they were tracking, and we were reconfirming pretty much if those are still the same goals that are included here. If we run into a case where, say that our communicable disease section is tracking now, it has been for like the last year, a different goal that's not included here, is there a way to archive goals that are existing currently in this, or would we have to create a new CD section with those new goals?
You could duplicate a group. So if I have CD, for instance, and I want to create a new version of it, what I can do is just do, this is my copy, and then I'm going to go up to the parent group, the department, and I would hit paste, and that would create a new version of the CD group, and it would say -copy at the end, just so you know which is which. Then you've got an identical version of it. It's got all the links in it. It's got all the people assigned to it. Everything's identical. So then you could archive one of them and then keep the other one as current and make the changes to it. Is that what you're asking?
Okay, so we wouldn't be able to go into the same one and archive like specific goals and objectives. They would have to be created as a new folder.
Well, if you wanted to do the entire plan, there is an archive feature at the service initiative level here. So each of these, if I wanted to archive customer service, for instance, this hide service button right down here, if I click on that and then save it, you'll see that it grays out. What that does basically is that and everything below it are now archived. They're there. They're available to anybody who's a manager or an org admin level user. But if you're a normal user, you won't even see it. So it does, in fact, archive from this level. And that's the lowest level you can archive at. You can't archive just at the goal, objective, or activity. But if I do archive this, it will, in fact, archive the goals, objectives, and activities. Now, I can also do the same thing as I did before at the group level. I can copy and paste. So I could make I'll go ahead and enable that for now. So I can make a copy of customer service, paste it right into here, and then I would have a different initiative or service in this case, a different service called customer service copy, and it would have all of the same goals, objectives, and activities. And then I can go in and just archive the old one, make the changes to the new one. So you can do that at any level at the service initiative, goal, objective, or activity level. You can make identical copies. And when you make a copy, it copies the entire pyramid all the way down identically. It doesn't seem like that's what you're looking for. Okay, talk to me.
No, I was just thinking, because we were talking about, like, we know when we replace the goals, the history of what was there is still accessible, right?
Right.
Like when we go in to update the goals, there's a way for us to go back, and see what was previously written.
Yeah, in this case, you just have the one history file.
We're at the point where we're generating reports for what was previously written, because say people went in already and started updating their goals from July through current.
Okay.
How can we generate reports for that previous reporting period?
You want the history report, or do you want the entire report for the service or the group?
Maybe like a history report for or as an example, maybe running like the history report for clinic to see their progress in the goals for July 2023 through June 2024.
Our intention is to use this to kind of capture what data periods or reporting periods are maybe missing information that can help us kind of inform, hey, if you haven't had data for this period, please help us like collect that and identify it so we can then enter it with you. That's one way we're trying to use these reports, because we know that staff has changed, so some responsibilities on data reporting has changed. So it's kind of where we want to start, so to speak.
Well, you can generate reports. You can generate a report at the group level, as we talked about before, or you can generate a report here. So I can generate the operational plan report, which would give me the entire communicable disease investigations report. That's one thing. Now, if I go in and select this, I can go to my reports menu and go down to my history report. And when I do that, what you're getting is the history records that is basically in here. So in this particular case, communicable disease investigations, there's probably just one record in there. I'm guessing, yeah, the communicable disease was added in there. But if I go down to the goals, objectives, maybe down at this level, I look at the history, and there we go. So we got all the history. So the history report will give you basically this information back from the very beginning. You can see this is 8/9 of 2019 all the way up to 2022. So it hasn't been really updated. The objective hasn't been updated since 1/28 of 22. So that is the history report. You can also, by the way, once you generate this report on the screen, you can use this export button to put it into a CSV file for a spreadsheet or something along that line, which then gives you a lot of capability to manage the data in there.
What would the larger one look like? You mentioned that, like CD itself, would it just be this, but for each like group or our service?
What now?
You mentioned that like you can do one at like the service level to get the report, but you can also do that up here at the top where groups is. And
yeah. So when you want to generate, let's say, an operational plan report, if I have the group selected and there's nothing down here under service initiatives in this little rollover down here, so you see the rollovers on here. We call this a cookie crumb. If there's nothing in there and I generate the operational plan report, so reports, operational plan report, it's going to be for the entire group, which includes all of the services. Now, right now, I'm looking at just the objective level here, but it's going to give me all that data in there, not the history data. It's going to give me the actual report data. I can go down to the activity level here, And now you'll notice we have, there's service 3 down here, COVID outbreak response, service 4, customer service. So if I do it at the group level, I get everything in one report. If I do it at the service initiative level, so if I just select communicable disease investigations, I'm going to get just that service, the report for just that service. So you notice it doesn't go any farther than this particular service right here. So that's the 2 different levels that you can report at.
Okay.
And
in regards to
the operational plan, that's not the history records. You can go in and generate a similar report that'll have all those history records. It can be a very long report. So you'll have like at the goal, and then you'll have all the history records for the goal, and then the objective and all the history records for the objective. So it can be long and confusing depending on what you're looking for.
Yeah. So I guess what would you think would be best practice to helping identify those gaps in reporting, kind of using the reports that we have available through this software? Would it be that history and just kind of being tedious and kind of going through that? Or is there another avenue?
What you're going to see when you go to the history, like we did on that one particular objective here, it says this particular objective hasn't been updated. Well, down here, the last updated that you see down here, 5/19 of 22 by Richard Rios was the last update on this particular objective. So I can look at the history file and see exactly the same thing, but this will let you know kind of where you are on the updates on this particular piece of the plan. And you should see that at every level. So the goal level, same thing, 5/19 of 22. Objectives, activities should be the same thing. Yeah, up here, 3/2 of 22. That looks like something I updated in there. So there's a lot of the history records available. Again, you can go to the history file, and then you can go in here and export it. If I go back to the objective here, no. If I go back to my objective, I can go up here and generate the history. Oops, wrong button here. The history report. It'll just generate a report for all the related activities. I'll say sure. And it's going to generate a report that has the history records. So the history records show up in this table. And again, like I say, it's a lot of data in there. So you got the history records for all the objectives and activities. And I can go up any level and generate that report. So again, you can have a really long report, and it's going to give you all the data in there. But again, does it really help you other than saying, well, this hasn't been updated since 1/28 of 22?
Okay, that could be one approach then.
Could I ask a question?
Yes, ma'am.
Go for it.
Right. So, when we're at the activities section for, like, let's say any of the sections, I know like there's like 3 activity types. It says like project-based activity. Well, let me log in again.
Well, QA and QM, quality assurance and quantitative measurement. And project-based.
Yeah. We were just wondering if you
Yes.
could explain those 3 again, because like we don't know which one would be best for.
Okay, let me take you to the demo group here, just so that I'm not messing up any of your data in there.
Okay.
And I'll go down here to demo test, and then I have examples of each of them in here. My goal, my objectives. Okay, so I got my objectives, and then my activities. So project-based activity. It's the simplest type, and it's the most common. It's about 85 or 90% of what you put in there is project-based because it's very simple. Think of anything that's a project to complete. So in this case, it says test sharps activity. Remember, we had one that says we're going to create training content. Well, think about, okay, the project is to create PowerPoints, to create some user guides, to create videos, whatever it happens to be that I need. It's a project, and it's going to be completed in a time frame. So that's basically what the project-based activity is about. The measurement for a project-based activity is typically percent complete, so 0 to 100%. So if I'm completing training content and I have 4 chapters that I'm making, when I get to chapter 1, I can say I'm 25% done. I get to chapter 2, I can say we're 50% done, etc. And there's a couple of different options on that particular one. And that's this down here. The default is 0 to 100%. So it just gives you a scale. But if I'm just going to say I'm either done or not done, I can go down here and say complete. And when I do that, you notice the 0 to 100% changes to a checkbox. So it's just either 0 or 100. And it's just a different way to look at it at that point of view. And then that third option that you see here is yes, no. Same thing. If the activity is worded like a question, have you completed the training content? Something like that. It'll be yes, no. No is 0%. Yes is 100%. So that's the project-based activity. And then every activity has got the same activity leader and team members and activity partners down here. Any questions on project-based activities? That explain it?
Oh yeah. So for this one, let's say like they put like something in their metric. Would this one automatically update the like stop sign?
Only, watch this. Okay, a project-based activity, when I take it to 100%, the traffic light turns to gold. And that is the only update to the traffic lights. Now, for years and years and years, we've looked at the possibility of changing traffic lights, based on values and things. And it's very difficult because usually there's so much other information that you have to consider. The one activity that does change it is this quality assurance activity. And that in the wizard here, you're going to set that value. In this case, well, let's see. Let me change that to, look at this one, don't save. And look at that. Okay. So the quality assurance activity is the repetitive one. So remember, we set a frequency here anywhere between weekly and every 5 years. We have a start date. That is the start date of the cycle. So if I have it measured as annually, then that start date today will be 7/1 of 24, beginning of the fiscal year. And then when I update it, it's going to say, do you want to move that start date ahead by 1 year? Because that'll be the next cycle start date in here. And then the values that you put in here are going to make the, this thing got messed up here. Anyhow, are going to make the traffic light change. So in this case, I'm going to go ahead and flip this around here and say if it's greater than 5, it'll be green. And if it's less than 2, it'll be red. And I'll say save that. So what we're doing here is this one sets the traffic light based on the values. So if I have a target of 5 in here, and that's going to be green. And then if I say if we only get to 2, that's going to be red. And if we're greater than 2 and less than 5, it's going to be yellow. So this is the only one that is fully automatic on setting the traffic lights. And again, this one is only used when you're doing something repetitively and when you want to automatically set the traffic light based on those values. When I go here to save this particular type of activity, it's going to ask me, do I want to move the start date ahead? So I go here and hit the save button. It's going to give me this option. Would you like to update the cycle start date? Because I've set it for annual, it's going to say, do I want to move it to 7/1 of 25? I could say, no, I can use the current date. So whatever, October 21st today, I can say, no, I don't want to change it. Or I can say select, and it's going to give me the one, well, in this case, it was the next year. So it's 1/1. So I can go in and update that. So I'm going to say 7/1 of 25. I'll say, okay. And what I'm saying now is my measurements are now coming in the next cycle, the next annual cycle. And again, remember, those cycles can be anywhere between weekly, quarterly, monthly, annually, biannually, bi-monthly, 2 years, 3 years, and 5 years. So I can set those anywhere I want. So again, the QA activity is the least used, by the way, because it requires something that is repetitive and you want to automatically set that traffic light. Questions on the QA activity?
So that's the only one that would automatically, based on the numbers you said, would change the traffic light. The other two would be us manually updating it.
Yeah, other than the project-based activity going to 100%.
Okay.
Yeah, and we're actually, by the way, we're looking at different ways to set the traffic light. So let's say you got a cycle that's an annual cycle, and it's January 1 through December 31st. So you got a 1 year cycle, and you're saying you're going to be today is July 1, so you should be 50% done. So you could set the traffic light automatically based on if I'm on track or ahead of track, I can be green. If I'm slightly behind that, so if I'm 50% of the way through the year and 50% done, I'm on track. That would be green. If I'm 50% of the way through the year and only 40% done, we could set that to yellow. If I'm 50% of the way through the year and 30% done, maybe we set that to red. But you got to figure out what are those calculations and how are you going to do that. It's something we've been working on for 15 years, to tell you the truth, to find an algorithm that will set those. But we're kind of trying to figure out how to do that in the background. So if you want to, it's going to be like this if you don't want to. But if you want to, you can go in there and manually create the algorithm that sets the traffic light for you. It's not there yet, and we're still kind of working on that, trying to figure out what is the best methodology to do that. So right now, this one is fully automatic, and the project-based activity based on 100% is automatic. Other than that, it's a manual setting. And again, typically the traffic lights indicate if I'm on track, I should be green. If I'm somewhat behind schedule or something is causing me to be slow, I'm going to be yellow. If something bad has happened, it stops the project, then we're going to mark it as red. Let me give you an example. Let's say we're going to, we had an example of contacting 20 tobacco vendors, within a couple of month period in here. So let's say that I set it so if it's behind schedule, it's going to go to yellow or red in here. Well, let's say I'm doing this over the course of 3 months, and the first month I contact 5 tobacco vendors. I'm on track, actually. I should still be green at that point in time. But if you calculate that, 5 out of 20 says we're at 25% complete. So you could set the light to yellow or red at that point in time. So those are the kind of things we run into trying to figure out the automation of the traffic lights in there. Does that make sense? Okay. The third type of activity, which is the second most used type, is the quantitative measurement activity. The QM activity is almost identical to the project-based activity with the one exception, and that is that you can actually set a target value in here. So in this case, I go to my little wizard again. So a beginning and ending date, just like the project-based activity. My target value, in this case, remember we're going to do 20 tobacco vendors or whatever it happens to be in here. So I'm going to say my target is 10. Decimal or dollars. Decimal is just anything you want to count that are not dollars, I guess. And then dollars is the ability to track dollars for grants and budgets and that kind of stuff. So if you go dollars, everything has dollar signs and 2 decimal places and that sort of thing. The metric type down here, in this case, we're saying we're producing widgets, was our test activity. Data entry types, the default is enter a value to add to total. So down here, you'll see it's at 10 out of 10. Our target was 10. We've made it to 10. It calculates to be 100% done. If I were to add another 2 in here, it's going to say now our rolling target is 12 and we're at 100%, 20%. And just FYI, if you go in there and you accidentally put in a 2 and you want to take it out, you can just go in and put in a -2 and it'll take it back to where it was in here. A couple other options on that particular type of activity. The enter a new total value, if I select that, the roll up goes away and I'm just entering a discrete value in here. So again, in this case, I would just say, we've done 12 widgets produced or whatever it happens to be in here. So I've got 12, it calculates to be 120%. So that's the measurement on this particular activity. There is another kind of a hidden option in there. If I go back down to here, we call it a zero target. So sometimes you do not have a target. You just want to count something. I want to count the number of vaccinations. I want to count the number of medications distributed. I want to count the number of car seats installed, whatever it is. So I put in a zero target. And when I do that, the percent calculation goes away. A real simple reason for that, you can't divide by 0. So 0 is your target. So I can't divide by 0, so I can't calculate it. But again, what I'm doing here is just counting how many did I do. So at the end of the month, I'm saying so far I've done 12. And, again, I had no target, but I'm just counting up the number of vaccinations we did or the number of whatever we did in there. So that's the QM activity. Think of it as a project-based activity with a target number, and they're pretty much identical other than that. Those are the 3 types of activities. Maribel, does that kind of help? Does that answer your question?
Yeah, it does. Thank you.
Okay. What else can I show you?
I was also wondering. I know Graciela mentioned that we had a lot of people complete the sandbox training. We were wondering if you provided like certification or like a completion, like
The answer is
document.
yes. Uh,
Okay.
and in fact, I think Andrea may have sent out a bunch of certificates. But I'll tell you what, if one of you wouldn't mind and just sending me a list of the people's names who actually completed that sandbox, we will get the certificates printed up and send it out to you. They're really pretty certificates, I can tell you that.
Okay, I'll get those forwarded to you sometime this week then, so that we could get those out to our staff because we're
Yeah.
trying to encourage a bit more to complete it.
Yeah, and by the way, we've had a lot of people who've kind of made a little ceremony out of it, and just say, hey, and bring the people up one at a time and said, here's your certificate for operational planning. And it's kind of a nice thing to do, and it gets people involved and continuing to stay involved in the system.
Okay,
Yeah, get those names to me, and I will get those sent out to you. I'm thinking we sent out a bunch the other day. I don't remember if they were to you. I mean, obviously it could be to anybody anywhere, but and I have no memory, by the way. So what else can I show you?
I was wondering if you had any overview materials, like a quick at a glance, maybe 1-pager, 2-pager guide that we could share with our staff. Like
Yes,
a reminder of controls and what they mean.
We got a couple different things. We got the brochures, a large and a small brochure, basically. We have some videos. We got like a 10-minute overview video, which is pretty good, pretty comprehensive without the detail. If you'd like, I'll send you copies of all of that stuff, and then you can kind of use it as needed in here.
Thank you so much.
I mean, but like I said, I have no memory, so I'm making a note.
Okay.
Yeah, I will send those along. I'll email those to you, and I'll send you the link to the 10-minute video.
Cool. Sounds good.
Yeah, that's by the way really a good thing. The 10 minutes is for most people who aren't really going to be really deep in the system. It gives them an overview of what the system's about, a little bit of detail, so they understand what they can do with it. What else?
I think I don't have any more questions. I think more so we're probably going to have more once we're actually meeting with.
We can do this as often as you need to, Brian.
Yeah, because I realized that we might have more as we're like walking individuals through actually updating their goals and actually inputting data and making sure that like the activity type is the correct one, and we're having that. So at this time, I don't have any more, but I'm sure we'll have plenty more for you as we're actually doing the work.
Let me ask you guys a question. Have you looked at doing the timeline activities to manage critical documents? Have you looked into that at all yet?
No.
Yeah. Let me kind of give you a quick little tour of that. So we have, let's say we created a group called critical documents. As I start going down the pyramid, we have the different types of documents. So we have policies, which are department policies, standard operating procedures, memos of understanding, grant documents. You could have FAB documents, all kinds of things. So under policies, then I might have a goal that says manage and update departmental administrative policies, manage department healthcare policy. So I'm breaking it down a little bit at a time. Underneath that, then I might have an objective that says update department administrative policies each fiscal year. Okay. And I've assigned that to a specific person in here. Then I get down to my activity level and I say, update the department 24/7 coverage policy. Document management right here. Boom. I've got that policy attached. I've got both versions of that policy attached in there. So here's what happens. We call this a QA activity, but we've selected this timeline checkbox. And as all that gives you is this one field that says percent to yellow. So in this case, I'm saying 90% of the way through the year, because we have an annual cycle beginning on the beginning of the fiscal year, which you can set anything you want. 90% of the way through years, which is kind of like mid-May, I think, the light's going to turn yellow. When the light turns yellow, then Andrea is going to get an email from the system that said, hey, it's time to update this particular policy. She's going to go in here. She's going to download the current policy from the document management. She's going to update that policy. She's going to upload the new version. If she uses the same file name, it'll just create a new version of that particular document, like you saw a minute ago. And then when she saves this, it's going to say, do you want to update the start date? So it'll move up to 7/1 of 25, and you start all over again. So what it's all about is just managing critical documents when you know they have to be updated, like on a fiscal year basis, and you know who's supposed to be doing the updates, but you don't have that linkage that says, hey, Fred, you need to update this policy by the end of the fiscal year. So that's all built in there for you if you guys want to play with that and use it. It has been the most popular feature in the system since we rolled it out about 9 months ago, just because everybody seems to have the same problem with managing critical documents in a time frame. So it's in there if you want to play with it.
Dang. So this would allow us to upload PDFs of policies?
Absolutely.
Interesting.
You can upload any kind of documents, any type of documents, any size of documents, and as many as you want.
I'm sorry, you probably said this already, but this is sounding all like news, and it sounds very exciting.
Well, I'm glad, because this is really a cool feature. And here's something else you can do. So you can, don't say. So at the group level, I can say that Brian has read-only access to this group, which means he can go down there and look at any one of those policies. He can use them for what they're meant to be for, right? Whatever that policy happens to be, but he can't update it. He can't upload a new version. He can't make any changes to it. And then the person, in this case, it was Andrea, if you remember, we give her read-write access so she can go down and update the policy. Everybody else can go in and look at it, use it for what it's meant to be. It's in a nice organized tree fashion there to be able to get to them in there. This was actually developed by for one of our health departments in Michigan, because they came up with that exact issue, that they have all these policies and they don't have a way to manage the updates on those policies. So we just built that feature in there for them, and poof, presto, changeo, they love it. So, and if you guys want to dig into that a little deeper, please let me know. We'll set up something and we'll actually build it into your system that way with some examples.
Yeah, we might take you up on that, because we have several policies that we're looking at updating. So kind of having these automatic reminders generated would be a great thing to do.
Yeah.
For the user to be notified, it would have to be a user that's at least a normal user in the current license, correct?
It would be anybody who's the user who's assigned to that particular activity.
Okay.
And that person then, when it goes to yellow, would get the automated email.
Gotcha.
Okay. Well, if you guys don't have anything else, I will let you get back to work, and I will do the same. And please, as you're going through this and you need any help updating stuff, moving stuff around, please feel free to reach out. I'm happy to help.
I think I have one more question. Sorry.
Yes. Okay.
There was an employee who has been saying when she wants to add stuff to her section, it's saying your access privileges do not allow you to perform this action. So I'm not sure if they're allowed to edit their section.
Okay, let's go take a look at that. So I'm going to go to the main menu up here. I'm going to go to users. Who's? Mm-hmm. Oh, hang on, I got the wrong. Let me get back to you guys here. Okay, so I've got Madera. I'm going to go back up to users. What is the employee's name? Last name?
Last name is Element. Yeah.
Oh, right there. Okay, this group links button determines that. So I'm going to click on that. And what you see here is the view says they can see it. The edit says they can make changes to it. So which is the group that you wanted to be able to make changes to?
Epi? Yeah, okay.
Okay, so Epi, okay, so right there. Now, poof, presto, changeo, she has access to it. So you guys can go in there and change those. Just select the user, hit the group links, and then you'll see this is what they can see, this is what they can edit. If they don't have edit privileges, they can't add, they can't update anything. It's just a view-only access.
Mm-hmm. So should she be able to edit like her section now?
Yep. She's open now for that whole group, the whole Epi group.
Okay.
In fact, do me a favor and ask her to go in and try it. And if if she has any trouble, get hold of me.
Okay.
And this was accessed by just clicking on the user.
Yeah, I go to the main menu, click on users here, and then click on the specific user name, and then go down to group links.
And we have access to this as well, right?
If you guys are org admins, then yes, you have access to it.
Okay.
Let's see. Brian, you're an org admin. Flores, all right.
It might be Montano.
Oh, there we go. Okay, so let me go down to.
Because I think I have 2 accounts.
Yeah, you do. We've disabled the one here.
Yeah.
So, okay, so yeah, you're an org admin as well. So you guys are all org admins, so you can make all of those changes. Now, something we might want to do, since you guys are all org admins, is schedule a 30-minute org admin training about all this stuff that we just talked about. Because there's a lot of things you guys can do that nobody else can do. You got like superpowers, so don't abuse the superpowers. But about a 30-minute training, we can go through everything that you guys have access to.
Cool. That sounds good.
When you get to that point, just let me know. Pop me an email. And we'll set up a training.
Okay. Then maybe we can do that for maybe the first week of November.
Sure. Whenever you want.
In addition to the training materials, would you mind sharing the recording for this once it's ready?
Well, thank you. I will do that. Yeah, what I'll do is I'll send you the link, and it takes it about an hour to post up on YouTube, but I'll put it in there for you.
Okay, cool. Thank you so much.
Okay. Well, thank you guys for your time today. I appreciate it. It was good to see you all. And again, you know where to find me.
Okay, we'll see you soon.
Okay,
Have a good
thanks.
day.
Bye-bye.
Thank you.
Bye.